You are living in a state of constant, burning agony. A severe electrical pain shoots through your buttock and travels completely down the back of your leg. Your legs feel incredibly heavy, and after walking for just 10 or 15 minutes, the cramping and numbness becomes so intense that you are forced to sit down. You are absolutely convinced that you have a massive herniated disc. You finally undergo a magnetic resonance imaging scan. You meet with your doctor, ready to discuss treating your disc. But the doctor looks at the report and says, your spinal discs are perfectly normal. However, you have a synovial cyst in your spine. For a patient, hearing the word cyst is terrifying. You immediately associate it with a tumor, an infection, or cancer. You feel confused, scared, and completely misunderstood. If this is your current reality, you must listen very closely. You do not have a tumor, and you do not have cancer. The pain in your leg is absolutely real, but it is not coming from the front of your spine. Today, we will explain the physical mechanics of a synovial cyst, how severe arthritis has caused your spinal joint to leak fluid, and exactly how we safely remove this highly pressurized bubble to permanently stop your sciatica. To understand why a cyst has formed inside your spine, we must analyze the internal engineering of your spinal column. Your spine relies on two distinct structures to handle physical movement. In the front, you have the rubbery spinal discs, which act as the shock absorbers. In the back of the spine, you have small, bony connections called facet joints. These joints act as the mechanical hinges. They allow you to twist, bend backward, and lean forward. Just like the hinges on a heavy door, your facet joints need lubrication to move smoothly without generating massive friction. In a healthy human body, the facet joint is wrapped in a tough, watertight covering called the joint capsule. Inside this sealed capsule is a thick, slippery liquid called synovial fluid. This is your biological engine oil. However, as you age, or if your spine becomes unstable, these facet joints endure extreme mechanical stress. The smooth cartilage inside the joint is destroyed. The bones begin to grind directly against each other. This is a condition called Spondyloarthrosis, or severe facet joint arthritis. As the bones grind, they trigger massive inflammation. The body produces excess synovial fluid to try to lubricate the failing, burning joint. But the joint capsule cannot handle this massive increase in internal pressure. The watertight seal begins to fail. A microscopic tear develops in the joint lining. The highly pressurized fluid forces its way out of the joint and balloons into the surrounding tissue. Because it cannot escape into the thick muscles of your back, the fluid bubble expands inward directly into the central spinal canal. This bubble is the synovial cyst. You now have a hard, highly pressurized balloon made of fibrous scar tissue and joint fluid, occupying the exact physical space where your delicate spinal nerves are trying to travel down to your legs. This mechanical reality exposes a massive flaw in how general medical practitioners treat this condition. Because the symptoms of a synovial cyst perfectly mimic a classic herniated disc, patients are often sent to physical therapy for standard sciatica stretches. They are told to bend forward, touch their toes, or undergo aggressive chiropractic adjustments. If your nerve is being crushed by a highly pressurized fluid bubble attached to a broken hinge, aggressively twisting and stretching your spine is a catastrophic mistake. Bending and twisting the arthritic joint acts exactly like a mechanical pump. Every time you twist the broken hinge, you pump more synovial fluid out of the joint and directly into the cyst. The bubble expands, increasing the crushing force on your nerve. Physical therapy cannot repair a torn joint capsule, and it cannot deflate a trapped bubble. Furthermore, many doctors will order a general epidural steroid injection. They inject anti-inflammatory medication into the spinal canal to calm the nerve. While this might temporarily lower the burning sensation, it does absolutely nothing to fix the plumbing leak. The hinge is still broken, the fluid is still leaking, the cyst will remain exactly where it is. Some specialists attempt to use a needle to physically puncture and drain the cyst under X-ray guidance. However, the medical data proves that because the underlying joint remains unstable, the cyst almost always refills with fluid a few months later, and the agonizing pain returns. We cannot properly map a synovial cyst with a standard X-ray. An X-ray only shows the shadows of your bones. It is completely blind to joint fluid and nerve compression. To see the true mechanical failure, an elite neurosurgeon demands a high-definition T2-weighted magnetic resonance imaging scan. When we evaluate the T2 MRI, we are utilizing the physics of the magnetic field. On this specific sequence, water and fluid glow bright white, while nerves and bones appear dark gray or black. We examine the axial, top-down view of your spinal canal. We bypass the spinal discs in the front and look directly at the facet joints in the back. We are hunting for the white pearl. If a synovial cyst is present, we will see a perfectly round, bright white circle attached directly to the facet joint. We can physically see the dark line of the cyst wall, and we can measure the exact millimeters of space it is consuming inside the spinal canal. We must determine the severity of the clamp. Is the white bubble gently touching the nerve root, or is it so large that it is completely crushing the main nerve sac against the wall of the bone? We must also order dynamic weight-bearing X-rays. We ask the patient to bend completely forward and completely backward while taking the images. This is crucial. We must determine if the broken facet joint has caused the entire spinal segment to become unstable. If the bones are physically sliding back and forth when you bend, a condition known as Spondyloarthrosis, this changes our surgical approach entirely. Before we discuss the surgical cure, we must address two terrifying scenarios that occur if the cyst is ignored. Some patients attempt to aggressively exercise, or they allow a chiropractor to violently twist their spine, hoping to pop the cyst like a balloon. This is a highly dangerous gamble. If the highly pressurized cyst suddenly ruptures, you might experience a brief, temporary moment of mechanical relief as the pressure drops. However, the highly inflammatory synovial fluid will instantly flood the delicate epidural space around your spinal nerves. This triggers a massive, agonizing chemical fire in your lower back. Furthermore, because the underlying facet joint is still completely unstable and arthritic, the cyst will inevitably refill with fluid, and the crushing nerve pressure will return. The second, much darker scenario occurs if the cyst does not rupture, but instead slowly hardens and calcifies. As the arthritic bubble continues to grow inside the bony spinal canal, the physical pressure on the nerve root becomes absolute. The nerve is clamped so tightly that its microscopic blood vessels are completely choked off. In neurosurgery, we call this avascular nerve death or ischemia. Without oxygen, the nerve begins to permanently die. The sharp, burning sciatica will slowly transition into a heavy, dead numbness. You will lose the motor function in your calf or your foot, potentially leading to a permanent foot drop, where you can no longer lift your toes to walk. You are actively racing against the clock to save the blood supply to your leg. Because a synovial cyst is a physical obstruction caused by a plumbing leak, our treatment protocol is highly targeted and strictly mechanical. We do not mask the pain with pills. We must remove the obstruction. If the dynamic X-rays prove that your spine is structurally stable and the bones are not sliding, we use advanced, minimally invasive microsurgery. Through a tiny incision in your back, using a specialized surgical microscope or an endoscope, we create a tiny window in the bone to access the spinal canal. We carefully navigate around the delicate spinal nerves. We do not just drain the fluid, we must physically dissect and remove the entire fibrous wall of the cyst. By extracting the actual balloon tissue, we ensure that the cyst cannot easily refill. We gently shave away the overgrown arthritic bone spurs from the facet joint to widen the tunnel and permanently free the crushed nerve root. However, if our diagnostic tests prove that your spine is highly unstable, meaning the broken hinge is causing the vertebrae to violently shift back and forth, simply removing the cyst is a medical failure. The severe instability will instantly cause the joint to fail again, and a new cyst will form. In this specific scenario, we must combine the decompression with structural stabilization. After we remove the cyst and free the nerves, we use advanced, minimally invasive fusion techniques. We use specialized titanium implants to permanently lock the sliding bones together. By stopping the unnatural motion, we permanently eliminate the mechanical stress on the joint. The leak is sealed, the nerve is free, and the leg pain is cured forever. Many patients with synovial cysts accept their daily agony because they are terrified of spinal surgery, or because their local doctor told them to just keep trying physical therapy. They spend thousands of euros on endless chiropractic adjustments, useless oral supplements for their joints, and dangerous daily painkillers that slowly destroy their internal organs. But let us look at the true cost of accepting this passive advice. If you ignore a highly pressurized cyst crushing your spinal nerves, the neurological tissue will eventually suffer irreversible damage. The constant pressure starves the nerve of oxygen. The sharp, burning pain will eventually transition into permanent dead numbness. You will lose the strength in your leg muscles, potentially developing a permanent condition called foot drop, where you can no longer lift your foot to walk. You are risking lifelong neurological damage and the loss of your independence because your doctor is trying to treat a ruptured mechanical hinge with a pill. For a fraction of the cost of endless, useless treatments, you can have an elite neurosurgeon review your imaging, potentially saving your nerves and ending the pain permanently. If this video helped you understand your pain, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution to your pain. But you cannot fix a mechanical spinal problem by guessing, and you cannot fix it by asking questions in a comments section. If you have an MRI, do not just read the paper report. Every spine is unique. Click the link in the description to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your imaging, find the exact location of the synovial cyst, evaluate the stability of your joints, and build your personalized, minimally invasive treatment plan. Stop living in pain and stop guessing. Let us find your solution today.